I'm Dr. Art Mollen.
And I'm Olivia Fierro.
Welcome to Hope You're Feeling Good. I've practiced medicine for over 50 years and seen the face of medicine go through a complete metamorphosis. Physicians have more diagnostic options and tools, however, less time to personalize patient care. The healthcare landscape has become more difficult to navigate, so you'll need more information to advocate for yourself. I'm here to answer your questions as well as educate you with the latest breakthroughs in medicine. At the end of the day, I hope you're motivated to take better care of your health. I'm Dr. Art Mollen.
And I'm Olivia Fierro.
And we're going to motivate you, educate you. We're going to advocate for your health, and we hope you're feeling good.
We hope you're feeling good. And if you're not, you know what? The doctor is in the house, and he's going to help you truck along a little bit.
Exactly. And later on, we're going to have an interview with the former Surgeon General of the United States, Dr. Jerome Adams, a good friend of mine, and I'm really looking forward to interviewing him. He is quite an individual and has a tremendous background, so it'll be very exciting to have him on the program.
Yeah, what interesting perspective. A VIP. You know all the right people, Doctor.
Well, I'm fortunate to have met them.
So we'll check in with your new bestie a little later in the program. Right now, we want to talk about, this is a really great topic. We're here in the desert. There's so many traditions surrounding the plants that grow in the desert, and much of them can really be considered to be medicine.
They're actually medicine. Native Americans use them for many years, and some of them are culinary delights for the Native Americans. And so I want to go through some of these, and it's quite a list, but the ones that are most prominent are the saguaro, saguaro cactus, we know that, the creosote bush, mesquite trees, you see them all over the place, prickly pear, the sagebrush, and then the jojoba. And jojoba is an oil. It's like a topical oil. So you don't want to ingest it, but you can use it on your skin. They say it helps to promote the skin, to actually heal. So if you have dry skin, you can use it. If you're having hair falling out, you can use it on your scalp to actually promote that. It has some type of anti-inflammatory effect. And also, like if you have eczema or you have any type of psoriasis, you want to use some jojoba oil. That can be beneficial. And so it's something that's out there that could be a consideration and something that people might want to even use. Yeah,
not to mention the good old-fashioned aloe vera plant, right?
Exactly.
Get a little cut, you got to put it on there.
Right, and we use the aloe vera for years, but the saguaro is interesting because the saguaro, and we see those cactuses, and I don't know if you've ever seen the saguaro fruit,
yes.
Cactus fruit, and they sell it in the stores. So it's actually nutritional. It has about 126 calories for a serving. It mostly carbohydrates, a little bit of protein, a little bit of fat. So they actually can be beneficial for people, in terms of reducing inflammation. So the saguaro cactus may be something, it's high in fiber, which is interesting. So that can help to prevent constipation, can improve your bowel movements. It has B12 in it. A lot of people use it as an anti-inflammatory because it helps rheumatoid arthritis. So that's something, that you might want to consider. Some of the side effects, it could upset your stomach if you're taking too much of it, but it seems to be something that does have lots of vitamins, vitamin C particularly. It's high in that. So consider the saguaro cactus fruits, next time you're out shopping around.
Yet another appreciation a reason to appreciate the iconic saguaro cactus that's so special here in our desert. We're thirsty all the time. I'm thirsty all the time. I'm always carrying around a big jug of water, as you know. So the big question, tap water versus bottled water, Dr.
Yeah,
Mollen.
so tap water, and interestingly enough, if you were to buy a gallon of tap water, it's 0.005 cents. So it's basically pretty much free. A gallon of bottled water can cost you up to $10. So basically, when we're talking about the cost, of the tap water versus the bottled water, there's obviously a huge difference. It's suggested the health benefits of tap water are just as good as the benefits of bottled water, that there's really no difference as far as contaminants. The Environmental Protection Agency, they oversee it. They look for contamination with anything like arsenic or, other types of bacteria, E. coli and things like that in the water. So tap water has a pretty good screening process, and it is regulated quite well. There are legal limits for all of those contaminants. The bottled water, of course, that comes from these artesian wells and different springs, and so we see that advertised, and a lot of people think that that's going to be healthier for them. They're willing to pay $10 for the bottled water, but I'm not certain that it's even necessary. My wife likes the bottled water. When I go into a restaurant, I'll say I'll have the tap water. Just make sure you put a little lemon and ice in it. So I'm not a fan of the bottled waters as much as regular tap water. I think it works.
And at home, we have a lot of the systems. People can do the reverse osmosis, or even the filters that you pour the water in and you put it in the refrigerator.
The interesting thing is when they do blind taste tests, people can't tell the difference.
I believe it.
They can't tell the difference.
Yeah.
It's not like tequila,
Then you can tell the difference. You got to go with the good stuff. I believe it. It's all packaging and kind of what we've been taught to, think is good or good enough, right?
Exactly.
Yeah.
Right.
All right. I think these are probably, this next topic is really where your heart and soul, in medicine and wellness lies, which is diet versus exercise and weight loss. And I know how important healthy diet, of course, but I guess when you're thinking diet, you're thinking of caloric cutback. But exercise, if you're choosing one or the other, they need to go hand in hand.
So I think it depends upon what you're searching for.
Okay.
If you're searching for weight loss, then you absolutely have to concentrate on diet. It's going to be 90% diet and 10% exercise. So cut back on your calories. Don't cut it back below 1,000 calories a day, because then you're going to slow down your metabolism, and you're not going to be able to burn up the number of calories that you need to in order to help you lose the weight. But when it comes to dieting and losing weight, it's all about the diet. I just think the diet is going to be critically more important. Now, if we go to the other side of the coin and we're talking about fitness and we're talking about cardiovascular improvement and you're worried about your heart, then I think certainly diet's important. You want to reduce your cholesterol and watch what you're eating, but on the other side of the coin, concentrate on the exercise. So now we're probably talking about 90% exercise and 10% diet. So you want to increase your exercise, elevate your heart rate so that you get a beneficial effect on your heart and lungs, and that helps to lower your resting pulse. So your resting pulse should be, in the range of about 70 to 80 beats a minute. The more you exercise and the higher you're able to get your pulse rate up through the exercise, you're going to condition your heart so that your resting pulse gets lower and lower. I've had marathon runners who have pulse rates as low as 30 and 40 beats per minute, and simply because they're well conditioned. So it depends upon what you're searching for when we talk about exercise and diet.
Okay. We're searching for all the things.
Yeah.
The fitness,
we
the
want
weight
everything.
loss. We want everything, but we don't want to put in so much work. It just sounds so hard when you say it that way.
Yeah. Somebody once said you can have anything you want, but you can't have everything.
At least not all at the same time, right?
Right, exactly.
Okay, we've got some great questions for you today, Dr. Mullen.
Okay.
Beginning with, this is coming from Anonymous, so it could be any of us. It could be me. It could be you. My 63-year-old husband doesn't seem very physically, sexually interested in me. So I am 38 years old. We've been together now for 10 years. So obviously, concerned about what could be going on, focusing first on the physical. Do you think that maybe it's a testosterone issue?
Yeah. So I think this is something that you first have to address the emotional issues. Let's see if there's an underlying problem. Are you depressed? Are you drinking too much alcohol? Are you not sleeping well? Is there some other reason that you're not sexually motivated, at this time? So I think we have to look into those areas before we address taking testosterone or anything like that. I think having a blood test, and let's make sure there's no underlying medical issue. Let's make sure there's not an underlying cancer even. Let's make sure that there's not some cardiovascular problem, that your heart isn't pumping enough blood, into areas, particularly certain parts of the anatomy, So I think that's important as well. Are there medications if you're suffering from something like erectile dysfunction? There's Viagra, there's Cialis, there's medications for that, if that seems to be the problem. But I think we have to address the emotional issue.
Yeah.
I mean, no question about it. If people are not having a relationship that is working for them, and if the husband is suffering from some type of anger issues, then he needs some anger management. If there's some underlying depression and underlying anxieties that he's having, I think we have to address all of those issues before we start saying, oh, okay, he just needs some testosterone, let's put him on that, and have your testosterone level checked, because that'll often determine if that's low. And that isn't necessarily always a coefficient of libido. You could have you could actually have a high testosterone level and still have a low libido.
Oh, okay.
So, there's a lot of issues, that we have to address here.
Yeah, with human beings, everybody's complicated, right? So the nature of the relationship, and if there's a closeness, if there's too much tension between the two, I mean, all of that is going to be
So talk
relevant.
therapy, cognitive behavioral therapy. You need to have a counselor get involved as well. Once you've had all the blood tests and you discern there's no underlying issue from a medical standpoint and the testosterone level is adequate, then get some counseling.
Good advice. This is coming from Jenna. Jenna is 52 and is going through menopause. She's having all the stuff, the hot flashes, the mood swings. She does not want to take hormones, but she's really feeling agitation and, all of the disruption. Of course, you're fatigued because you're not sleeping well when all of that's going on through the night as well. So what do you suggest if she is still trying to avoid the hormone therapy?
So the first line of treatment for hot flashes, first of all, is basically an SSRI. So these medications which increase serotonin levels in your brain, that is really considered to be one of the first treatments for menopausal hot flashes. So whether that's a Prozac, whether that's a Zoloft, the one that I often would prescribe is called Effexor. And Effexor is one that, again, it's a prescription medication, but it falls into that same class of medications that can increase serotonin levels in your brain. However, there's a new medication, and it's called Veozah, and that's Veozah. And Veozah is a new medication which specifically hits the hypothalamus area in your brain and affects temperature. So you won't have the hot flashes that someone else is having by taking that. It's non-hormonal. So you want to avoid the hormones, whether it's the estrogen, the progesterone, the testosterone. You want to avoid those hormone therapies if you can. But for some women, they are effective, and you might even want to consider them once everything else is eliminated. But Veozah is the new medication that they're using for specifically hot flashes. And again, is there depression? Is there anxiety? Are there panic attacks? Let's address all of those issues along with it.
It really is kind of remarkable that half of the population of the world goes through this. And there's so few medications on the market, so little discussion up until very recently, about it. And quite often a doctor won't even be bringing it up. I've heard stories of people being tested for severe illness, and really they're just in menopause.
They're in menopause. You were talking about cruises that they're having now for menopause, and where they have physicians who give lectures on menopause, and menopausal women will go on these trips to try to discern what the underlying treatments are and which is best. So again, I have to say that exercise and diet are important. You may want to do the cold plunge, and we reduce the inflammation in your body, and all of those things can help from the emotional side of it. So once you address the issues, and then you can discern what the exact and best treatment are.
Okay. Hey, we may have come up with a business idea. Hot flash, cold plunge, a specific place. Let's marinate on it.
I love it. Sounds like a website.
It does. All right. This is coming from Allison. Allison says, my 12-year-old daughter is overweight. Can she take any of these new medications for weight loss?
Yeah. So the only medication for weight loss, again, we're talking about the GLP-1s or semaglutides, is called Wegovy. And so Wegovy is the only one that's actually approved for weight loss. In March of 2023, it was approved for 12-year-olds and up. The pediatricians throughout the country are reluctant to prescribe these medications unless a young male or female is significantly obese, basically having a body mass index above 35. So normal is basic 15, 18 to 25. So if it's above 35, then they consider that person adolescent to be a candidate, but it is approved for 12 and up. So it's a consideration. But if you have a child that's 10 or 15 pounds overweight, absolutely not. It's exercise, it's diet, change their lifestyle, change the foods you're feeding them, change the foods in your house. And I think eventually they're going to be fine.
Okay. This is Danielle saying, my husband has been having severe back pain for the past 6 weeks. 6 weeks can be eternity when you're in pain, right? We have been to urgent care and he was prescribed pain medications, however, without any significant relief. So what type of doctor should he be seeing?
So if you have been seeing a doctor and you're taking a bunch of pain medications and you're taking it for a period of 6 weeks, that's a red flag. Stop, because you need to have that further evaluated. Who should you have it evaluated by? I would suggest that you have it evaluated by a neurosurgeon. Now, the reason I'm going to suggest a neurosurgeon is because it's going to be a lot easier for them to actually order an MRI and get it approved by the insurances. If you go through your family physician or your internist, it may be more difficult for them to get that prescribed. And then you may be another 3-4 weeks or month and a half, 2 months with this type of pain. The problem is if you start to experience that kind of radiculopathy where the pain is starting to radiate down to your legs, you're having difficulty walking and things like that, you need to have the MRI because you want to evaluate the discs in the low back. Let's see if there's pressure on it. And I had one patient, again, several years ago, that actually had a tumor in the spine from the same kind of back pain. They were treating it with medications until they finally went to someone who did the MRI, realized it was a spinal tumor that was causing pressure, and they would potentially have been paralyzed if it had continued. So they were able to go in, do the MRI, remove the tumor. The tumor was benign. Patient was up and walking within 4 to 6 weeks. And they were fine. So if that pain lingers on for that long a period of time, you need to be a little more aggressive with the treatment and try to advocate for yourself.
Yeah.
I can advocate for you, but you need to advocate for yourself.
Right. You got to have an understanding of what is going on in there, right?
Exactly.
Okay. So I definitely wish them the very best of luck. Danielle, that is tough, but we've got some good advice for you. What do you say? We don't all have a doctor in the family, so maybe it's time for family medicine where we can share the love and share the knowledge so that everybody is feeling good.
Yeah, let's go to the family. It's always interesting to have family questions because being a physician, I get these questions on a regular basis, and between my nieces and nephews and daughters and sons, and my wife, there's always a medical question du jour.
Sure. Okay, let's start with, we mentioned BMI just a moment ago. Is BMI a good indicator of body fat? And I have heard a lot of conversations lately about whether this BMI system is kind of like antiquated.
Yeah. Now, who was that? Who asked that question?
I don't know.
Well, I think it was Nick, actually. Okay. And so Nick is our producer. So, and we put him under family medicine because he's part of the family. So when he asked me about, BMI, and because he has 0% of body fat on him, but basically BMI or body mass index, it doesn't really measure body fat, such as a coefficient of, again, your height in meters versus your weight in kilograms. 1 kilogram is basically 2.2 pounds. So you have to divide that by the number of meters, and that gives you what your BMI should be, again, between 18 to 25. But it has nothing to do with how much body fat you have. It's really just a coefficient of your body mass. And it's a great way to evaluate whether or not you're, obese or you're having those problems, but it doesn't necessarily pinpoint body fat.
I have known people over the years, though, who have gotten these evaluations, whether it's just putting the numbers in, and they're completely average sized, and then they're told that they're obese based on this BMI.
Yeah, exactly. Because it doesn't take body mass index. It doesn't take your body type into it.
Right.
It doesn't take whether you're an ectomorph, mesomorph, endomorph, those types of things. So it doesn't take all of those things into account.
Okay, so an indicator, but we won't get all worked up about it. So stay relaxed, Nick.
Sure.
Okay, you just relax. You're doing
Nick,
fine.
You'll be fine.
This is Samantha. Samantha says, I'm having hip pain for the past several weeks since starting Pilates. Uh-oh. It is in the front of my right hip, radiating down the leg. So what could be causing this?
Well, this is kind of interesting because Pilates, and a lot of people will take the Pilates, but, I did some research on this, and I don't take Pilates, but, there are 3 exercises in Pilates that you should avoid. One is called the clamshell. The other is lying on your side and raising your hips up. The other is putting the legs in the strap and spreading them apart, and doing I think it's called circumduction, and so there are certain exercises. And if Samantha, again, was doing those exercises, that's the reason that you have that hip pain. So you have to avoid those. Stop those for about 2 to 4 weeks, and probably the pain will resolve by just taking some anti-inflammatories. But you have to be careful of that clamshell exercise, which basically is one of the key ones that most of the experts in Pilates will say, hey, eliminate that exercise, and you're going to be able to eliminate that hip pain.
Okay.
Because a lot of times you can get the hip pain and it'll radiate all the way down, even into your knee, and affecting the psoas muscle down into the knee and cause knee pain along with just the hip pain. But especially when it's hip pain and it's more lateral as opposed to right in the center of your buttocks.
Okay.
So
the irony is Pilates designed as kind of a recovery for dancers, I think, right? But you can get injured doing anything.
Right. Exactly. Yeah. Yeah. I mean, Pilates is a great exercise. I'm certainly not telling people not to do Pilates. It's just certain exercises. If that seems to trigger a particular injury on you, then just back off of it for a while.
Okay. Now Francine. Francine says, my blood pressure is 150/90, and I'm taking medication and wondering which number is important, the top number or the bottom number. And I still to this day don't understand the blood pressure numbers.
Okay, so the first number is called your systolic blood pressure.
Okay.
And the systolic blood pressure is basically when your heart is pumping out and it's putting pressure on the arteries.
Okay.
The diastolic, which is the lower number, that's when it's more relaxed. So that's when the heart pumps out and then it relaxes. It pumps and then relaxes. So traditionally, it was always suggested that especially for people over the age of 50, that systolic blood pressure is really the most significant. So the top number, if that gets above 150, 160, then you probably are going to need medications because that one will seriously affect heart disease and your risk for cardiovascular disease. The diastolic, again, is important, but perhaps not as important unless you're younger. If you're younger and you have an elevated diastolic, the bottom number, and that seems to elevate, say, over 100 or 110, then that gets into the critical area. So a normal blood pressure should be somewhere around 110/70, or 120/80. They're normal blood pressures. If your blood pressure is anything above those, then it should be evaluated regardless of whether it's the systolic, the top number, or the bottom number. Both are important. People over 50, again, systolic top number is far more significant.
Okay. And then I guess a lot fewer people deal with the low blood pressure,
yes,
right?
No question about it.
High blood pressure is what we're concerned about.
Yeah.
Great questions, Francine. Thank you so much. And Samantha and of course, Nick, we got some good perspective today in our family medicine segment.
I know. The family, I'm sure they're going to have more questions for next week. But next, we're going to be interviewing the top doc, and that's the
Wow.
former Surgeon General of the United States, Dr. Jerome Adams. And I'm so excited to interview him because he's a good friend of mine, and I think he's probably one of the most significant physicians in the country, and was in the midst of the entire COVID
Yes.
epidemic that we had throughout the country, and he's going to give us a lot of perspective on how he handled things. And he has a new book out, and we're excited to talk about his new book and Dr. Jerome Adams.
Stay tuned.
I am so honored today to introduce to you the former Surgeon General of the United States, Dr. Jerome Adams. He was the 20th U.S. Surgeon General, and he has a best-selling book called Crisis and Chaos. It's an amazing read. I mean, I learned so much from this book. It's talks about the front lines of war against COVID-19. He led us through 5 hurricanes, raging opioid epidemics, a pandemic. He tried to restore the public trust in the CDC, which was lost. He did everything humanly possible. He's not only was he the former Surgeon General of the United States, but he was also the Health Commissioner of Indiana. He's an anesthesiologist by training, and presently a distinguished professor and director of health equity at Purdue University. It is an honor to introduce Dr. Jerome Adams. Thank you so much for being with me.
Oh my gosh, it is a pleasure to be with you today. And man, I'm just exhausted from you reading about all that stuff that I did. But really, I one of the reasons I'm really glad to be with you today, and one of the reasons I wrote the book, is that it's important that people understand what the system looks like and the challenges and the opportunities inherent within that system. And I've been blessed in my life to be able to see the system and work within the system at many different points, and far too often points of failure.
What do you think was the biggest mistake that the government made during the pandemic?
Well, one of the biggest mistakes that I think they made, and a couple of them that I lay out in the book, and I know you said one, but I think there are a couple, and they're in different areas. We didn't pay attention to health equity. We didn't pay attention to the fact that not everyone has the opportunity to make healthy choices. So, concrete example, we tell everyone stay at home. Well, not everyone has the ability to work from home. And so you might lose your job. You might lose your insurance. If you're a frontline worker who's driving an Uber or working in a grocery store, those folks had to stay out and keep working. And in many cases, those folks were far more likely to contract COVID. We know certain folks have a higher burden of chronic diseases like diabetes, like high blood pressure, like obesity. And those folks, when they got sick, were much more likely to end up in the hospital. So I think that's one point of failure, is that we tried to give a universal message and didn't recognize that not everyone had the opportunity to make healthy choices. But I also think we have to own the fact that we did a terrible job of communicating. And there are many reasons in the book which I go into for those communication failures. But when we were literally imploding in New York City, we sent out a national message to shut down. Well, the truth is that while New York City was imploding, Boise, Idaho barely saw a case. And so they heard us saying, oh my gosh, this terrible virus is wreaking havoc on our country, on our nation. And it didn't match up with what they were seeing in real life. So in many cases, they lost confidence in what we were telling them to do, particularly as we were telling them, you need to stay at home. You need to not send your kids to school. You need to close down your businesses, even though there was a threat that they didn't perceive.
You've talked about initiating certain steps that we can take in the future to prevent this. Now, recently, the government has basically said, we're not going to pay for the COVID test anymore. That doesn't sound like an initial step to get us forward in preventing another pandemic, that they're not going to pay for it. And again, just as you were talking about, a lot of people can't afford to buy these tests at the drugstore.
Well, what's interesting is there's a big debate now, literally at this moment, about whether we are still in the pandemic or whether we are post-pandemic. And there's a belief amongst a lot of people that we're in a post-pandemic phase, because we have some of the numbers really are improving. Fewer people are ending up in the hospital when they get COVID. Fewer people are dying. It's hard to say whether or not spread is up or down, only because, as you mentioned, we're not testing anymore. And so you can't see what you don't test for. But that said, we also know that we've got better tools than what we had in 2020. We've got vaccines. We've got antivirals like Paxlovid. We have availability of PPE for those who want to use it. And I still mask when I'm on a plane. But once again, for those individuals who don't have access to those resources, who don't have insurance and now can't get a test, they are not in a post-pandemic phase. And those folks are still getting sick, still ending up in the hospital, and still dying. And so I think we have to, again, and I don't want to belabor the point, but understand that the United States is a big country with a lot of diversity economically, geographically, culturally, and we need to create policies and messages that actually take into account that diversity, and not just say, hey, everything's fine, or, oh my gosh, the sky is falling for everybody.
Yeah, and on that exact point, Dr. Adams, it's interesting because during this entire time, you were receiving hate mail, you were receiving death threats. The government was basically using you as a sacrificial lamb and throwing you under the bus and not supporting. I personally, followed the whole thing very closely. And I was like, why are they putting this on the Surgeon General? Why are they doing that to him? And it just didn't seem fair at that time. And then after having read your book, it made me even more upset, at the government and the administrators and everything else. And the CDC, of course, lost all their credibility during that time. But you're lucky you made it through this without somebody, trying to kill you.
No, and you bring up a couple of really important points that I want to hit on. Number one, public service and public servants are under attack. And this is my message to the public. You're not going to agree with everything that public servants do all the time. But if we create an environment where good people are not willing to step up and serve because they're literally in fear of their life, then it's going to be bad for all of us. And I'm very concerned about the next decade in our country, where we're seeing decreased vaccination rates, and we're seeing the recurrence of measles right now. We're seeing public health under attack and being defunded. That's going to have catastrophic consequences for all of us moving forward. But you also mentioned 2020. I highlighted this in the book. 2020 was truly a once in a century type of occurrence, not just in terms of a once in a century virus. It also coincided with the most divisive presidential election we've had in our lifetimes. And I highlight the fact that I would go out and talk about the virus and science, but what my audience was hearing was, hey, you're supporting Biden, or hey, you're supporting Trump when you say that we should wear a mask, or when you say that you don't have the authority to enforce a mask mandate. And so that was a real challenge. And it's interesting because, well, we're now at a point where it looks like we're going to have a rematch of 2020 in that, in terms of an election. And I think it's important that people understand when we're talking about important policy issues, we have to learn to separate our political beliefs from our ability to listen to and have conversations about the science. Right now, if I say I wear a mask on an airplane, 90% of people out there in their minds think, oh my gosh, that must mean he's a Democrat and he's voting for Joe Biden. And in turn, if I say, I don't wear a mask when I'm out at dinner with my family now, people won't listen when I say I'm looking at the COVID rates, I'm vaccinated and updated on my boosters, and I'm making a choice that's best for me. What they hear is, oh my gosh, there's Trump Surgeon General saying it's okay for everybody to go out and not wear masks. And, that political overlay really hurt our ability to have important conversations about things that were consequential for our country. And I worry that this is going to happen again in 2024. if we don't heed those lessons.
Yeah, I agree with you. It's so divisive and contentious out there. Interestingly enough, the top doc, which you were the top doc, you're the top doc for the nation. You're not the top doc for the Democrats. You're not the top doc for the Republicans. You are the top doc for the people of the United States of America, and that's what people don't understand. And so having read your book and and seeing how much you suffered during this whole thing, I have so much empathy for what you had to go through and everything with that.
Well, I do want to say that I come from a military family, and I believe in service, number one. And oftentimes you're going to be put in difficult situations if you're in the military, if you're in the uniformed service, and so it's part of the job. But I do want people to understand that if we create a climate where good people won't step up and serve, it's going to hurt us all. I also am very open about the fact that I am religious. And when you look at the Bible, no one wanted to be where God put them in the Bible. Moses said, no, wrong guy. Noah said, no, you got the wrong guy. And so I really leaned on that during tough times. Not that I am at all comparing myself to those amazing individuals, but that I had to reflect back on the lessons that I was supposed to take from reading the Bible, and that is that we're all going to be put in tough times. And when you do, you lean on family, friends, and faith, and you just do the best job that you can. And if you do that, then ultimately things will work out as they're supposed to. And that's what I did. And I really do believe I was able to accomplish a lot of good in my role, even though in many cases, people for political reasons or other reasons will only focus on or see the bad.
Well, I think you should get combat compensation for what you just sustained. So
I agree with you. I agree with you there. I took some lumps.
That should be retrograde. You need to know. They should have given you a little more love during this whole thing. At any rate, you recently had an experience where you had to go to the Mayo Clinic in Scottsdale. You had hiked Camelback Mountain. You had some dehydration. You were taken to the emergency room by ambulance and then treated there. They gave you a couple bags of probably dextrose and water and saline solution to hydrate you. And the next thing you know, you got a bill for $5,000. And when you mentioned it, they said, oh, you'll probably get another bill for the ambulance ride for another couple thousand. I mean, you came out with a statement and you said the healthcare system in this country is broken. Tell me about that.
Well, what's interesting is that I got thousands of replies from people all around the country sharing similar stories of being hit with insane bills for care that literally should have cost them a few $100s. You can get someone to come to your house and give you IV fluids for a couple $100s right now.
Right, sure.
I got charged $10,000 actually with what the bill was.
Oh,
and my portion that I was responsible for after insurance, because I have a high deductible health plan, was $5,000.
Oh my God!
And so you can contrast that to many places in Europe, many other developed nations where they're delivering the exact same care, similar quality or higher quality, because they actually have better health outcomes and higher life expectancy in most of Europe than what we have in the United States, for free for most folks. If you're a U.S. citizen and you go there, it's a couple $100s that you're paying. And so I wanted to highlight that, not for my own sake, but because 100 million people in this country are in medical debt. Medical debt is the leading cause of bankruptcy in the United States. And so it's hurting people financially, but it's also hurting them from a health standpoint. It's discouraging people from coming in for care because people hear my story. And unfortunately, one of the things that they take away, which I don't want them to, is that, oh my gosh, the next time I feel bad, I better not go to the emergency room because I'm going to be hit with a $10,000 bill. But I lift it up because I want people to understand that even when you're the United States Surgeon General, even when you make a decent amount of money, as I'm blessed to be able to do as a physician, you're still not immune to the shock of a unexpected medical bill that causes you to have to shuffle different things in your life. And again, I'm not crying poor here. I'm not saying poor me. I don't want folks to feel sorry for me. But even for me, it was like, oh my gosh, they want $5,000 in 30 days. Let me figure out where I'm going to get this money from. The average person out there in the United States in that situation would literally have to be deciding whether or not they're going to put food on the table, whether or
So,
not they're going to pay their kids college tuition.
so, so,
A world like that's not a world we want to live in.
so how do we fix it? How do we fix? I mean, socialized medicine, like other countries like that.
I do believe that we can move forward with the system we have in the United States. I'm a practical person. I just don't think we're going to get to socialized medicine no matter what. So we can have a conversation
I
about
agree
it,
with that.
but
Yeah.
it's 20% of our GDP. There's too many people who are making money off of it for me to expect that we're going to get there anytime soon. That said, if you want to have a market-based system that functions, you have to have transparency. And one of the problems I pointed out when I talked about my story is that not only did I have no clue how much this was going to cost, Mayo Clinic didn't tell me and couldn't tell me how much it was going to cost so that I could make an informed decision. If I'd gotten to the emergency room and they'd said, this is going to cost you $5,000 after insurance, I would have said, okay, thank you. I'm going to leave now and go home and drink Gatorade because I believe this is dehydration.
Right.
To be honest with you, I thought it would cost maybe a couple $1,000s, to get IV fluids. And for me, I said, okay, well, that's worth it for me to go in and get IV fluids and get checked out by medical professionals. But I would have made a different decision if there was transparency. So we need to make sure there's transparency in cost. And once there's transparency, then we can start to have accountability. We can say, okay, Mayo Clinic, which is where I went, their ER in Scottsdale, you're going to charge $10,000 for these services. I can go to an urgent care clinic or I can go to another emergency room and get these services for half the amount. And then I can actually exercise choice. But you can't exercise choice with no transparency, and you can't hold people accountable for what are in many cases insane overcharges. One example I'll give you, they did a basic blood test called a comprehensive metabolic panel on me. The average cost in the Phoenix area for a comprehensive metabolic panel is $34. I got charged $375 for that same test during my emergency room visit, 11 times what the area average is.
It's so ridiculous.
But again, you don't find that out until after the fact. And even then, you don't find it out unless you know that you can demand an itemized bill, because they didn't send me an itemized bill. They just sent me a number. Hey, you owe $5,000. And then I, because I'm a physician, knew that I could ask for an itemized bill.
Yeah.
And then got it.
They probably did an EKG on you, and you probably could have used your Apple Watch to take your own EKG.
Exactly. Well, and that's another thing that
was
folks are
probably
looking at.
$400 or $500.
Well, folks are looking at digital health technologies, interestingly enough, and new ways to provide care for people in their home, and ways that are less expensive than having to go into the emergency room to get checked out.
Yeah. No, I mean, I think that's probably the future. Do you think we need another agency besides the CDC to kind of oversee some of the things going forward? I mean, the CDC does only so much, and obviously because they've lost a significant amount of their credibility, since the pandemic. Is there a specific type of agency that you would create?
Well, that's a great point, and that could be an entire podcast and beyond. But very quickly, one of the challenges the CDC had is they're on the one side being asked to hold to the science. And the science tells us bacon is one of the most dangerous foods you can consume. But I like bacon.
Yeah.
And if the CDC comes out and says you should not eat bacon,
yeah,
I and a whole bunch of other people are going to push back. So they're trying to balance being true to the science with also putting out practical recommendations that people can and will follow. And so when you talk about a different agency, one of the things that I think we need to do is separate the science from the policy. And unfortunately, CDC was both supposed to put out the science, which said, hey, this virus is killing people. Hey, masks aren't the end all be all, but they provide an incremental benefit for folks. Hey, these vaccines are helping far more people than what there's any evidence that they're harming. That's the science. But then they're supposed to put out these policy recommendations that take into account people's culture, people's willingness to comply. That's not a place the CDC should be. And so I do think that we need to separate out some of the policy making, which has to balance economics and culture and religion and all these other things from the science, which is what we usually associate CDC with. I think another big problem is that the CDC director is a political appointee. The Surgeon General is a political appointee. And unfortunately now you're seen as being part of a particular partisan administration, no matter whether you're under Biden or Trump or Democrats or Republicans. I think these positions should be appointed positions that then have a term like the Supreme Court, so that even though those guys aren't so popular nowadays either, but at least, there's the idea that they can make an independent decision without being in fear of their job if they anger the boss at 1600.
Well, I'm going to vote for you to lead that particular committee. So, and I'll be happy to serve under it with you. As you know, I've practiced, preventive medicine and kind of proselytized the message of exercise and diet, over my entire career.
You have, and by the way, I like bacon, but in moderation, just a little bit, just every now and then. So
Well, I like the smell of bacon. My wife eats bacon. I don't, but I love when she cooks it, just so it smells pretty good. With these different suggestions in terms of like exercise and diet, and preventive medicine, is there anything we can do to kind of promote that more in our country?
I am so glad you asked me that question. Because it goes back to the health equity conversation that we started with. I 100% believe in preventative medicine and wellness. It is 1,000 times cheaper to prevent disease than it is to treat disease. And unfortunately, that's one of the problems in the United States is we have what I call a sick care system and not a healthcare system. We wait for people to show up with cancer, with diabetes, with a heart attack, instead of saying when they're kids, hey, how can we put you in a situation so that you don't have a cancer or heart disease or diabetes? And so it is important that we focus on prevention. And that is only going to happen with payment reform. So I don't want to get too wonky here, but we largely have a fee-for-service system in the United States. You come in sick, the hospital, the doctor, everyone in the care system gets paid to provide a service to you once you've been identified as having a diagnosis. So you have to be sick, and then we have to do something to you in order for us to get paid. We don't get paid in the healthcare system to actually keep you healthy. We don't get paid to talk to you about proper nutrition. We don't get paid to say, hey, how can we help you exercise? And so we need to change the payment system. We need to go to value-based payments in a world where we're actually compensating people for health instead of compensating people for treating sickness. That's number one.
Yeah.
But number two, we need to create more opportunities for people to be healthy. So really quick story, because I love talking about my daughter. She spends a little bit too much time on her phone. She's 14. And when she does, I say, Millie, give me your phone, go outside. I don't want to see you for an hour. And she can go out in my nice neighborhood. I have a nice neighborhood. We have sidewalks on both sides of the streets. We have a park in our neighborhood. We've got moms who stay at home, who keep an eye on her and are looking out and are reporting back. Oh, hey, I just saw Millie go by on her bicycle.
Yeah.
And it makes me a good dad because I took her phone away from her and made her go outside.
Oh, good.
You go 5 miles south of where I am. Different dad, different daughter. It is the rough part of Indianapolis. There are not complete streets. There are gangs. There are shootings that happen. And that dad tells his 14-year-old daughter, go outside. I don't want to see you for an hour. It's not a good dad. It's actually criminal child neglect. And so I tell that story because we have to create communities where the healthy choice becomes the easy choice for people. And that's not the case. Not everyone can go out and just exercise. Not everyone can go out to Whole Foods and buy fruits and vegetables and not worry about the cost of it or even have access to it. I mean, much of America shops at gas stations for their groceries because that's all they can afford and that's all that's near them. So when we create healthier communities, then people will make healthier choices and will be able to focus more on health and wellness as opposed to sickness and disease.
So now you talked about in the book that Oprah Winfrey called you during a time when you were probably, under the gun and even somewhat depressed and, feeling badly. What was that phone call like?
Well, I was at a very low moment because I was being attacked by the media. I was being attacked, um, just call it what it is, by a lot of Democrats because they saw me as being a vehicle for the administration. And I was questioning whether or not I should stay in the job, to be honest with you. It was bad for my mental health. It was bad for my physical health. I had high blood pressure. My labs were off. And Oprah Winfrey calls me out of the blue. It was a number that it said no caller ID, and I honestly don't know why I answered it, because half the time it's a reporter calling me and wanting something when that's happening. But I picked up the phone and answered it, and it was Oprah Winfrey. And Oprah told me that when you're in these high profile roles and when you're highly visible, people will attack you, but they're not really attacking you. They're attacking their frustration at the system. And you shouldn't take it on as being a personal attack. And she also said it's important in those moments, especially, to persevere and to understand that there are people out there who see the good that you're doing. They're just not often the most vocal ones. And it really put me in a better place, and quite frankly kept me from quitting my job. And I'm really glad to her for that. And the message I would pass along to other folks out there going through tough times is it may seem like you're alone, and it may seem like what you're doing is not being appreciated. But if you continue to focus on people and doing what you feel is right, then at the end of the day, you'll be able to hold your head up high, and the good people out there will ultimately see what you're doing and why you're doing it.
Well, detractors will always decry the accomplishments of great people like yourself. So I appreciate everything that you've done. And, having been in the medical profession myself for over 50 years, although I don't like to admit that and tell too many people, but,
and you still look great. You're a testament to health and wellness.
Well, it's a lot of work, and it doesn't get easier as you get older, but I can tell you it's certainly worth everything at the end of the day. I think, again, back to your point, more health screenings, are really good. There's a company called Lifeline. I follow them pretty well. They do ultrasounds of the carotids and abdominal ultrasounds. They pick up a lot of disease, before it's actually
early on
a serious consequence. I often recommend my patients to do it. And again, because the cost is so minimal in comparison to a lot of other, entities out there, as you said, if you went to the emergency room and you had all those screenings done, it'd be several $1,000s. So I recommend that. And then having blood tests taken, going to one of these labs or something, I think that's really a good idea. What, at the end of the day, is there an existential message for the American people?
Well, I would say that the message is that we all rise or fall together. And there are a lot of people out there who want us to see each other as either you're on my side or you're my enemy. And I think that approach is detrimental to us personally, but it's detrimental to our future on this planet. There's far more that we share in common amongst individuals than what there ever could be that separates us. And if we focus on those commonalities, the fact that most people just want to be able to live a healthy life, they want their kids and their family to be healthy, and if we create opportunities for people to make healthy choices, in most cases they will. That's what I want people to ultimately remember, is that yes, we can honor choice, and we can respect the fact that individuals are different. But if we create healthy communities, then ultimately it will be better for all of us, not only from a health perspective, but also from a financial perspective. Healthcare is the number two expense for most Fortune 500 companies. The U.S. spends 3 times what the OECD average is for healthcare, but yet our life expectancy has been less than the OECD since 1980. And so ultimately, for us, for our kids, for our planet, for our society, we need to focus on creating healthier communities.
Well, I think you're going to be head of this new agency, and I'm looking forward to helping you on that. And so the book is called, again, I want everybody to see it, Crisis and Chaos by Dr. Jerome Adams. It's absolutely a compelling read for everyone who is interested in their health and what the future of medicine is in the United States. Dr. Jerome Adams, former Surgeon General of the United States, I am blessed and honored and humbled to have you on my program.
Well, this has been a fantastic conversation. I'd add in that you can get the book at Barnes & Noble, or Amazon is actually a good place to get it. And that actually I use the profits from the book to buy more books for young people so that I can give books away to young people, particularly those who are interested in health, but also those who may not imagine that they could be a physician one day. I grew up not thinking I could be a doctor because I'd never seen or met a Black doctor in my life. And so I'm not pushing the book because I want to make money off of it. I'm pushing the book because I really do believe in the lessons that I lay out in the book, and also because again, I wouldn't be here if there hadn't been individuals who had mentored me, had been role models for me, and I hope that in some way I can help inspire some other young next Surgeon General out there.
Well, I'm going to push the book because I think it's a compelling and insightful read for everyone, and they'll learn a great deal about the United States of America.
Thank you so much. I appreciate it.
Thank you so much, Dr. Jerome Adams.